You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Let's go right now to Dr. Suzet McKinney, CEO and Executive Director of the Illinois Medical District, Dr. McDougle, President-elect of the National Medical Association. Glad to have both of you. I want to first start with you, Dr. McKinney. What we're dealing with now is, again, you had Donald Trump playing games with moving these dates around. Governors have said, look, this is nonsense. Now we're seeing more governors ordering shelter in place because until you have far more testing taking place in the country, you cannot get a handle of this coronavirus until that happens.
That's correct. And thank you first and foremost, Roland, for having me on the show today. I really appreciate that. And I also have to, give a word with regards to our governor here in Illinois, Governor J.B. Pritzker, and his leadership. And I think what we are seeing with governors across the country is the understanding that you cannot identify an arbitrary date by when we will reopen the country. As Dr. Fauci said a week or so ago, the virus itself will determine the timeline. And so governors are really on the ground in their states, seeing what is happening, seeing how overwhelmed our healthcare system is, and they are stepping up to the plate and exhibiting great leadership and helping the American public understand that Easter is not going to do it. It's going to take a much longer effort before we begin to see a flattening of the curve with COVID-19.
And we also, you've got to do this because, frankly, let's just be clear. Americans have been stupid and idiotic, and I'm just going to say it, let's be honest. The mayor to shut down Lakeshore Drive in Chicago because these people continued to keep walking outdoors in massive groups. They keep congregating. The governor of Florida was pig-headed and not shutting down the beaches. And unless you order this, people are not going to pay attention.
That's right. We were all very excited about Mayor Lightfoot's leadership last week when she said, listen, folks, I'm seeing entire 5Ks being run on the lakefront. And so she stepped up and used the full police power here in the city of Chicago to ensure that the lakefront paths were shut down, as well as the public parks and some of the other public walkways. And quite frankly, I think it sent a strong message that this virus is much more serious than what many folks have been taking it. And the only way that we are going to begin to see our peak and then eventually a decrease in the number of cases is if people begin to take the shelter-in-place order seriously.
Dr. McDougle, I want to bring you in right now to this conversation in terms of where we're going next. You now hear the officials now saying, hey, keep these things in place until April 30th. This is now another month. And we saw all the games being played by saying, well, we could be Easter Sunday. We could open the economy back up. Please explain to people why we have not gotten a hold, really, of this coronavirus. And now when you hear Dr. Birch and Fauci say we could have as many as 200,000 deaths, that's now real for people.
So thank you, Roland Martin, for inviting me to present to your audience today. I'd first like to extend condolences on behalf of the National Medical Association for those lives that have been lost and those families that are suffering. In regards to these various artificial timelines that have been put forth, it really speaks to a lack of a plan. What is the strategy? Who's in charge? I know I wrote a piece this weekend speaking to from Katrina to coronavirus. What have we learned? And in the wake of Katrina, we saw where there was an initial failure of the federal response. Fast forward to 2019, just as the National Weather Service tracked the impending strike of Hurricane Katrina using satellite imagery, the National Intelligence Agency, Centers for Disease Control, and World Health Organization were tracking the impending strike of novel coronavirus on the United States. So we are behind. Katrina revealed cracks in the levees, and the novel coronavirus has uncovered cracks in our public health infrastructure and national emergency management system. So who's putting forth this plan? That's what we need. We need a plan. We need a strategy. Where is FEMA? Where is Homeland Security? We need leadership at this time.
Dr. McKinney, one of the things that really jumps out when we start looking at what is happening all across the country is that, as you heard Dr. McDougle talk about leadership. Look, you got Donald Trump at the news conference yesterday accusing hospitals of stealing masks. You've got the governor, Cuomo, of New York, who's saying there's a reason why you have to store stuff, because if you see if you see tragedy coming at you, if you see a train rushing at you, you better be prepared and stock up. It doesn't help, Dr. McKinney, in this moment to literally have the person in charge of the federal oversight saying hospitals are just stealing, saying, hey, it's going out the back door. That, to me, has to be crazy for a medical professional. It's got to be driving you crazy.
It is driving me crazy. I have spent the bulk of my career working in public health emergency preparedness. And what I will tell you, Roland, is from the SARS outbreak in 2003 to our concern over avian influenza in 2006 and 2007, even to H1N1 in 2009, we have been planning for a major pandemic to occur in this country throughout that entire period that I just referenced. And we have known all that time that if we were to see a major, large-scale outbreak of a pandemic here in the U.S., that we would have a shortage of supplies, primarily masks and ventilators, and that we would also see extreme stress on our healthcare system. And so, to Dr. McDougall's point, we need a plan, but these are issues that we've known about for quite some time. Now, what I don't want to do is discount the work that has been done in state and local health departments across the country. However, clear, decisive leadership is needed at every level of government, starting from the top. And if I could say something about the mask situation, what I would want people to understand is that when a healthcare worker has an encounter with a patient and they are wearing a mask, when they are done with that patient, the proper protocol is to remove the mask and discard it. And you get a new mask.
And Dr. McKinney,
for a new patient.
That's CDC protocol.
Absolutely.
That's CDC protocol. And so for Trump to stand there and say, well, why can't you just put some liquid on it and use it again, and you can use it up to 20 more times? What are you doing?
Unfortunately, that just demonstrates a misunderstanding of the way patient care is supposed to be undertaken. It is unfortunate, it is frustrating, and I cannot say enough about the heroic efforts of our healthcare system and all of the providers in our healthcare system across the United States.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they basically about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, it gives you that flower effect like that. But if I wanted to also, because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these Shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it.